Garcia. I'm an undergrad at Kaiser University in the sports med program. Today I'm going to be talking about medial tibial stress syndrome, better known as shin splints. Now, shin splints is the inflammation on the medial side of your shin bone, which is also your tibia. As you see in my diagram here, the redness shows the medial side, not the lateral side. If you have pain in the lateral side, it's anterior compartment syndrome, so don't get Some ways this injury can occur is for people who are starting an activity for the first time and they start to do a speed workout right away. That means if you feel pain on the medial side, that means that your calves are tight or your Achilles are tight and you're overusing it. So it's better to do cross training, like for example, do running and then play other sports as well. Also running on hard and flat surfaces like the sidewalk and the street, where you're constantly putting a lot of pressure on your shins if they're weak. So if that happens, try to switch it up, run on the sidewalk, and then the next day run on the grass because you'll be more soft. Some ways this injury can be prevented is by proper footwear, proper stretching, also cross training. So if you're doing, like for example, track and field and then baseball, it's good because you're focusing on other muscles, not just your shins. Another way to prevent the injury is by doing a proper warm-up. I would suggest doing about a mild warm-up so your muscles can increase the blood flow and they'll be heated up, so enough to be where you're sweating so you're not cold. Also, if you could get a resistance band, since like a flat resistance band where you tie it up for your foot so it won't come out. And you want to do some stretching to strengthening the shins. It's better with a partner, especially for side-to-side motions, so you feel it right here in the lateral side of where your fibula is. So but for this exercise, you could do it on your own. Just hold it so you have some resistance. Dorsal flexion, just like that. To get right here, you'll feel on the lateral side to get a strengthening so you won't have it. Shin splint. So some ways this injury can be treated is by RICE. And RICE stands for rest, ice, compression, elevation. Also, if you play sports in high school or college level, you want to ask an athletic trainer if they could tape it for you. So what they would do is use this spray adherent, spray it on, and then they would use pre-wrap. And what the spray does, it helps the pre-wrap stick on your skin. And they use the pre-wrap before the athletic tape because athletic tape can rip off your skin. You can also use therapeutic treatments. And what therapeutic means is it's related to the process of healing of a disease or an injury. You can use either treatment, therapy, or surgery. So some therapeutic ways to treat this is ice massage. So if you have like those Gatorade cups they use for sports, you can fill up with water, put in the freezer, wait until it freezes up, tear off the top of the cup to make sure you get the ice out. Put it on your shin and just massage it like this back and forth. You want to do that for 5 minutes. You don't want to do that too long. It's not where you put an ice bag and put ice on it in 10 to 20 minutes. This only takes about 5 minutes because you're giving it cryotherapy and you're also massaging at the same time. Another therapeutic treatment is E-stim. And what E-stim is electrical stimulation therapy. It comes with 2 pads. You put 2 pads there and it sends electrical pulses, almost like electrical massage, and it helps increase the muscle stability and muscle strength around the shin bone. And another one is hot and cold packs. The one I have, it's a pack. You could either put it for cryotherapy, you could put it in the freezer, wait an hour or so until it freezes, and you put it on your shin and leave it for 10 to 20 minutes. And then if you want to heat it, you gotta wait until it's in room temperature again, the pack. And you can put it in the microwave depending on how many seconds it says on the pack. And then you leave it on for until the pack starts to cool down when the heat is not there anymore. So some equipment that can actually help prevent or treat the injury is a calf sleeve, as they call it, which I'm wearing right now. You want to make sure that the calf sleeve is not too tight but not too loose, because if it's too loose, then when you start running, it starts to move down, and that will not help at all. So you want to make sure it's fit and tight, so when you run, it stays in place. Also, you want to wear proper shoe wear, which I have right here. These are Asics. For my opinion, they're one of the best running shoes to run in because they're not too heavy and they're not too light. You don't want to have light shoes when you practice. Only, like for example, for track and field, only for a race, not for practice. It also has good cushioning inside, the gel for support, of your back and as well as your legs. And you want to make sure it's tied tight but not too tight. So if this goes all the way up, like see this is tight so it doesn't go up, but if it goes up, that means that your foot is too loose, so your foot will move back and forth. And you don't want that because that's when you get a higher risk of injury. So you want to make sure it's tight, so where it's like that, so it doesn't go all the way up. And when you're done with activity, you want to make sure you untie your shoe. You know, you do not leave it tied when you take it out, because if you leave it tied and you put it back on tight, then that means that you will ruin the back part of the shoe. After a while, it will start to bend and it will break. That's how you can worn out the shoes. So I hope you all like my video, and that's it. Thanks.
We'll be right back.